The company that I worked was with Paxman Coolers, and the device is very similar to the other companies through Dignitana, which is the DignaCap. But this study was the first randomized trial in the world. So there's many other trials that have been done in Europe and other countries, but they have mainly looked at just scalp cooling and not compared them to controls. So in the US, there's been one other trial, and that was with the DignaCap. And Hope Rugo ran that trial, and it was prospective but not randomized, and only looked at one type of chemo used in breast cancer called the taxanes. And in that study, they had about a 66% hair retention rate. So what we're presenting here at San Antonio is the results of the randomized prospective trial. And this trial is a little bit different in that every single regimen commonly used in breast cancer was allowed. And we accrued patients from December of 2013 until September of 2016. And our interim analysis was positive because of superiority of hair retention in the group that got the scalp cooling. And that's the data that we're presenting here today. In our trial, we had 95 women that were in the intent to treat population that got scalp cooling, and 47 women that were in the control arm. And in the scalp cooling group, 50% of the women had hair retention. And we defined hair retention as less than 50% hair loss not requiring a wig, and a failure was more than 50% hair loss requiring a wig. And in the control group, there was 0% hair retention. So quite remarkable that half the women kept their hair if they used the device and none kept their hair if they didn't. We did do exploratory subset analysis looking at type of chemo. So in breast cancer, there are two main types of chemo that we use. One is a taxane-based chemo and one is anthracycline-based. And in the taxane-based chemo, the retention rate was 65%, which is very similar to the other US trial with scalp cooling, although they used a slightly different grading scale for alopecia. Now with the anthracycline, the rate was much lower. It was about 22%, but overall the results showed a 50% reduction. The device was very well tolerated. Patients reported it as being reasonably comfortable. There were no grade 3 or 4 adverse side effects. And the one thing that we did do, which was different than other studies, is because we had this randomized control group, we prospectively looked at quality of life. So there were 3 different quality of life questionnaires that were administered at baseline after 4 cycles of chemo, which was our primary endpoint, and if they got more than 4 cycles at the end of chemo. In the initial analysis from the interim analysis, there was no differences seen in those, but we'll see what the final analysis shows.
Okay. I did note in some of the literature around this, there were some concerns about the cooling system related to metastases.
Yeah, so the way that scalp cooling works is it cools the scalp down to about 64 degrees, and by doing that, you have constriction of blood vessels, which decreases the delivery of chemo to hair follicles and can decrease the biochemical activity. The concern was that if there were any breast cancer cells in the blood that was being constricted in the scalp, that you could perhaps have recurrence of breast cancer in the scalp. Now, solid tumors like breast cancer typically don't spread through the blood, like liquid tumors like leukemia. So we know from prior studies with leukemia that that's not safe. You can actually have scalp metastases if you use scalp cooling. So this trial opened in 2013, and about a year before that, there were 2 large trials from Europe that were presented, and one of them showed that there was no difference in recurrence, no difference in scalp metastasis as a first site of recurrence, and the other one showed that there was no difference in overall survival if someone used scalp cooling or not. And it was based on that safety data that the FDA thought it would be safe to use these devices in the US. As part of the study, we are following patients for 5 years after they complete therapy for recurrence and overall survival.
Okay. And just for some of the methodology of using the cap, is it entirely within a supervised setting, or is it something that could be taken home for more autonomy for patients?
Yeah, so with the devices, this is all done in the infusion center or an area near there. And it's a small refrigeration unit that's attached to a cap, and the cap is used for 30 minutes before chemo, the duration of chemo, which can vary with each chemotherapy regimen, and then for 90 minutes after. So typically, a patient would stay for 30 minutes after chemo, so it does add about an hour onto their day.
Okay. Well, I suppose the big question is, where next with this?
Yeah, so right now Paxman is filing for FDA clearance of this device, and that process usually takes 90 days. And we are hoping that if this is FDA approved, that we'll start seeing this device available in the US. One of the big limitations is going to be cost. The competitor that is available in the US now, from what I've seen, it costs about $1,500 to $3,000 per patient. And so I think one of the challenges is going to be to try to get insurance to cover this as a benefit. But it's exciting that this is an option that's going to be available for women, because unlike other medical diseases, when you have cancer and you lose your hair, you lose your anonymity, and everywhere you go, everyone knows. So it's hard to live a normal life even when you're out amongst strangers.